I think everyone at this point is aware of the opioid crisis in effect on the United States, and many people have a loved one that's been affected by the opioid crisis or involved or knows someone that was involved. When something's this massive or the problem's this big, it's paralyzing. I think people have a hard time understanding, or maybe they feel like they can't do anything to help the problem.
And what we're talking about here are common pain medications that are prescribed every day. So oxycodone or morphine are two people are probably familiar with, but also maybe less talked about, but equally dangerous, things like synthetic fentanyl, which is now becoming a street drug and is 100 times more powerful than morphine, or heroin, which people are also in general familiar with. Unfortunately, the most common way that people become addicted to medication, addicted to these opioids, is by misusing medicine that's in a medicine cabinet of a loved one or in a drawer in a bathroom somewhere. And then their use or abuse of that medicine turns into an addiction that often ends badly. I think we have a broader responsibility as healthcare providers when it comes to this opioid crisis.
I think one of the responsibilities is to govern those medicines that we give our patients. We've done this by starting a program called Crush the Crisis. So in essence, we're partnering with local law enforcement to reduce the population of pills, basically, to take back these opioid medicines from patients, removing them from their homes, and in the process, hopefully, not only educating that patient and their family, perhaps the local community, about the danger of these unused medicines in their home.
Absolutely, and you, through your leadership, have had a lot of success here in the Middle Tennessee market through the Crush the Crisis program.
Yeah, we've had two events, one here at TriStar Centennial, Nashville, and then also with the TriStar division. In the process, again, multiple hospitals involved, but we were able to collect over 200 pounds of opioid medicines, and that was the equivalent of close to 100,000 doses of opioid medicine.
And that's just fantastic work, and the opportunity not just to take the medication back, but also engage the community and educate them on the risks, I think was another powerful outcome of that event. Based on that success, HCA Healthcare has decided to do a national take-back event this year. It'll be on September 7th, and we have hospitals across the country who will be participating in helping take back those medications.
So what we're going to do is invite the community to safely dispose of the opioid medicines. It's completely anonymous with local law enforcement. And these medicines include, but are not limited to, hydrocodone, oxycodone, fentanyl, morphine, hydromorphone, oxymorphone, as well as codeine. We'd love to have everyone come out, and of course it starts with that understanding that they don't need these medicines in their home.
Participating in fighting the opioid crisis really speaks directly to our mission at HCA. We are, above all else, committed to the care and improvement of human life, and there's no way to address that better than keeping patients in our community safe from the risk of opioids. So we really encourage you to participate in our event, come out to the hospitals on September 7th, bring back your medications, share this story with your friends and loved ones, and help us partner with you to crush the crisis.